Good morning and welcome everyone to this month's Cyber Mentoring for PATHS at Region 1 in cooperation with DHR Health. We're very excited to be able to welcome Dr. Moira Javy today. Hi, Dr. Javy. How are you?
Hi, I'm good, thank you. Nice
Great.
to meet you. Yeah.
Just to remind everybody that this is being recorded and you'll be able to see this on YouTube. Those of you who are watching it live can go to the chat and ask questions. But let's get started. Dr. JB, tell us a little bit about yourself and what you do.
Okay, thank you. Thank you for having me again. So, like you already mentioned, my name is Dr. JB, Moira JB. I am originally from Ghana, which is a small country in Western Africa. So, just to put things in perspective, the size of Ghana is about the size of the state of Oregon. So, total population is about 33 million compared to 330 million population of the United States. So it's a really small country. It's on the coast, and that's where I was born. That's where I grew up. I had my basic education there, and after high school, I had the opportunity to visit the United States, visit family here, and I actually thought about coming to college in the US. And from an early age, I knew I wanted to be a doctor because I knew I wanted to serve others. And I thought the medical field would be a great opportunity to do that. So I applied for college here, but then I knew I had to do 4 years undergrad and then 4 years of medical school, as compared to my home country where it's just 6 years of medical school, like right after high school. So I opted for the latter and I stayed back home and I had my medical education. So I am currently a medical doctor pursuing my family medicine residency at DHR in Edinburgh, Texas.
Sorry, I
I
made the
think
big mistake of being muted. So tell me a little bit about your childhood, because I'm sure it was very different than our audience growing up in the Valley, or maybe it wasn't. Tell us a little bit about it.
Okay, so I'm African, and our community is kind of similar to the Hispanic community in the sense that we are very family oriented. So I grew up in a very small nuclear family. It's just me, my parents, and my older brother. So we were very close knit and we had a lot of family time. And my dad also happened to be in the hotel industry. So that afforded me the privilege to travel around a lot each time. He was a consultant actually. So each time he went to train hotel staff, he would take me along. And I mean, I like the fine things in life early on. So you could say I was a bit pampered. I am a daddy's girl. My dad is late though. He passed a few years ago, but then I was a daddy's girl. And my dad or my parents were very big on education. I wouldn't say they were so wealthy, but then financially they made sure most of their investments were in us and in our education. Yes. So from the get-go, they instilled in us the values of diligence, working hard, focusing on the education, and being better than they are or they were. So that was my family basically in my childhood growing up. Yeah.
That's awesome. I'm glad to hear that. So really not very different than kids in the Valley that focus on their families and focus on education and trying to work hard and do the best that they can. So that really isn't very different, is it? Tell us about being a teenager and going to high school, because that's students in our audience, that's what they're doing. So what was it like when you were a teenager?
Okay, so I think that's where the major difference lies. So back home in Ghana, high school is mainly a boarding school system. So right after middle school, you take a standardized exam, basically. So then the standardized exam places you through a match system and then places you in a high school of your choice. So then you choose about 3 high schools, and based on your performance in that one exam, you get placed in that high school. And then you are also, unlike the United States where you do a lot of programs, in high school in Ghana, you focus on one major. So it's either you're doing the sciences or you're doing the arts or you're doing the business. So then from the get-go, I knew I wanted to venture into medicine. So then I chose the sciences, and I was privileged to be able to get matched into my first choice, which happens to be one of the best all-girls high school in Ghana.
Congratulations.
So, thank you. So it's I went to an all-girls high school. It was a boarding school, and it was for 4 years. So high school was for a period of 4 years, and that's where I basically learned how to be independent because it's in a different city away from home. You get to see your family once every 2 or 3 months.
Wow.
Yes, that was hard. And I mean, I was just about 14 going on 15 years. So you learn how to manage your finances, you learn how to manage your time because you're in a very scheduled, structured system where there's a very rigid, and it was a Christian school. So aside there's the education aspects, we had to go to church, we had to go for service, we had to be very disciplined. So yeah, high school really made me who I am, I would say. Most of the virtues and the values I have in life are those I picked from my high school.
So this is about the same age as high school, though, like you said, like 14 or 15 to 15. And so you're living away from home, choosing what you want to study at 14 years old.
Yes.
That is very different. That's very different than how it is here.
Yeah.
And so what made you go into science rather than the arts or something else?
Okay, that's very interesting because I'm from a background of the arts. Actually, my dad was into the arts, my mom, and it actually came more naturally to me. I excelled better in the arts than the sciences.
Right.
But then I knew this was the path I wanted and this was the passion I had. So I honestly didn't see myself outside any field except the medical field. So I remember my parents actually sitting me down to ask me, are you sure you really want to do science? Because I was actually struggling a bit when I was in middle school. But then because of how dedicated I was, I spent so much time focused on the science and maths, because science and maths were not my strongest fields. But then I knew that I couldn't do the arts. Well, in Ghana, you can't do the arts, you can't do business and end up in medical school. You definitely have to go through, yes, a specific path. So it was tough. Honestly, it was tough in the beginning, finding my feet, because it didn't come natural to me. And I had my strengths were in the arts and English language and all that stuff. But then I persevered, and by God's grace, this is how far I've come here.
So you're 14, 15 years old, taking classes in something that you chose because of what you wanted to do 10 years from then. So what kind of classes were you taking when you were in high school?
So I took biology, I took chemistry, I took physics, I took some biochemistry and what we call integrated science. So that's just general science.
Right.
And then I also did mathematics. So I did core math and then elective math, which is like an add-on math. And at the end of high school, I had to take another standardized exam to be able to get into medical school.
Okay. So those 4 years are considered high school or they're considered college?
They're considered high school.
Okay. And so then you have to do 4 years of college and then 4 years of medical school on top of that.
No, that's the difference. Yes. So after the 4 years of high school, you get accepted straight into medical school, which lasts for 6 years.
Okay. I understand. Yeah. So how did you decide where you wanted to go to medical school?
Okay, so that was a tough decision, because like I said, my first visit to the US was when I was in high school. I think I was 15 years. And then my aunt I visited happened to be a nurse practitioner.
Okay.
So she took me to work, she showed me around, introduced me to her colleagues, and she was excited because she knew I wanted to take her part.
Yes.
So yeah, she basically encouraged me to apply to colleges here, which I did. So I took the SAT from back home in Ghana.
Right.
I happened to be successful. I actually got some scholarships for colleges here. And then the decision had to be made. So I did apply for medical school in Ghana and then also college over here. Then when it came to weighing my options, I thought that first of all, the duration was going to be longer over here. I was going
Right.
to spend 8 years here. And I mean, after college, I know you have to take the MCAT to be able to get into medical school. So it's not like a guaranteed path
Right.
compared to me being accepted into medical school straight away, which was guaranteed for me back home.
Right.
So, and then it was going to be 2 years shorter. And I knew that definitely I would always have the chance to take the boards, the USMLEs, and then apply for residency here. So I decided to just stay back home.
So let's talk about that a little more. So if you would have come to the US, it would have been 4 years of college, take an MCAT, which doesn't guarantee you going into medical school, and then 4 years of medical school, and then the
Yes.
board. But because you went to medical school in Ghana, it was 6 years, and then you came to the US and took the boards?
Yes. So after 6 years of medical school, I graduated as a doctor, but then that's when I started studying for the boards.
Okay.
Yes, I graduated before I started preparing for the boards because the standardized exam at the end of medical school is a bit different. So I couldn't combine the two. I needed to
Right.
focus on graduating first. And then after I started taking the boards back home in Ghana. So you can take the USMLE step 1 and 2 in Ghana, and then the step 3 is when you have to come to the US to take that exam. But in between, I was coming while on long vacations just to come and do some rotations and get familiar with the clinical system over here. So that's why I spent most of my vacations doing.
And where in the US were you doing that at?
Okay, so the first time I was in Delaware, and then I went to Boston and Pennsylvania. So pretty much the East Coast, northeastern parts of the United States.
Okay. So you take your boards and you do well, or no, you don't do well at the beginning?
Yes, so I take the traditional route is to take the step 1,
Right.
then the step 2, then the step 3 while you're in residency. So, but the step 1 is more of basic science and the theory, and step 2 is more of the clinical application of what you learned in the basic sciences.
Right.
And my strength happens to be the clinical application. So I decided to go the atypical route, and then I took the step 2 before the step 1. So I was successful at the step 2 on my first attempt, but I wasn't successful on the step 1 the first time I took it. So I had to give myself a few months, but by that time I was already in the United States because I had already graduated. Yeah, I had already graduated, so I was here pretty much just studying.
Right.
And then I prepared again, and then I took it again, and then I was able to be successful the second time. Yeah.
Oh, good, good. So what did you learn from that? From, every time we're not successful at something, hopefully we learn something. What did you learn from not being successful? Excuse me.
Definitely perseverance, because this was the goal set before me, and I mean, I had come too far to give up.
Right.
Yeah. I mentioned earlier that my dad passed. It was actually around that time my dad was diagnosed of terminal cancer, and within a few weeks he was gone. So it was a very stressful period in our family. Like I already mentioned, we are very close-knit.
Right.
But then I just reminded myself that my dad would be proud of me if I pushed through, and I needed to get it done regardless. So, I mean, I just put myself together. I looked at my weaknesses, and then I was able to correct them, and then I was successful on the second attempt.
Did you have any assistance when you were preparing for medical school? Did you hire a tutor? What did you do to prepare?
Preparing for medical school or the boards?
The boards, I'm sorry, the boards.
So actually, no, I didn't have a tutor. So what I used to do was I joined a few study groups, a couple of study groups, and we used to just help each other. And then I just subscribed to a couple of question banks, and so there's a whole lot of resources out there to assist, especially foreign trained medical graduates while preparing, because the dynamics obviously are very different compared to if you train here in the US. Yes, so there are lots of resources available.
And where were you living at this time?
So I actually moved to South Texas in 2021.
Ooh,
so I moved
right after the pandemic.
Yes.
Well, I guess we were in the middle of it, weren't we?
Yeah, so I moved here because my husband actually got into residency in 2021.
Okay.
So we got married in 2020, and then in 2021, when he marched successfully into residency in West Laco, we moved together.
Okay.
Yeah.
So I was basically from the US?
No, he's from Ghana.
Okay, he's from Ghana.
Same med school, yeah.
Okay.
Yeah.
So was his path the same as yours? Is that the path of anybody in Ghana who's coming to the US? Did he have the same path or did he have a different path?
So he had the same path, but basically there are two main paths. So some people, rather than choosing to write the boards immediately after medical school, will opt for a graduate degree like an MPH, which is a Master's of Public Health.
Okay.
Yes, so other people will opt to do that just to get into the US system, familiarize themselves with the terrain, and then prepare for the boards.
Okay.
So a majority of people do take that route, coming in and getting a master's in public health, and after, which takes about a year to a year and a half, then they prepare for the boards and then they apply for residency. But then it's longer.
Yes, because you've added some time there for that master's. Okay, I understand that. So you passed the boards. And then what? What happened next?
So I passed the boards. I applied to residency programs. And interestingly enough, I always thought I was going to be a pediatrician.
Okay.
Because I'm the younger of my parents' children. So I used to babysit my younger cousins a lot. I used to take care of children. I used to teach in Sunday school at church. I really love children. So I thought that would be the perfect field for me. But then I actually had strengths in other areas, like in OB, especially in sports medicine. I also used to be very athletic. So I applied to both pediatrics and family medicine. So just a little background, family doctors or family physicians take care of the total population from babies to teenagers to adults and to the elderly. So they are more or less considered like the jack of all trades in medicine. Yes. So I applied to both specialties, and then so how the process works is after the application, you get interviews from some of the programs you applied to. And all my interviews happen to be in the northeastern part of the country. And mind you, my husband is here. He's working in West Laco, and we also happen to have family here. So I really didn't want to go far from family because
of course not.
Yeah, no one wants to go far from family. So it wasn't really what I wanted. So I was a bit hesitant. And then out of nowhere, I should say, out of nowhere, there was a new program which just opened in DHR in Edinburgh, which happens to be close to West Laco. So after the March cycle had already ended, this was in May last year.
Right.
So they put out the opening that they were going to take residents and start. So I mean, I just applied because I'm in the area and it's still family medicine within the scope that I wanted to practice in. So I just sent in my application, and within a couple of days, I was asked to have an interview, and same day I got my contract and I was taken as a resident.
Crossing all your fingers and all your toes, hoping it works out so you can stay here. I understand. Okay,
Yeah.
so you're a resident now?
Yes, I'm a first-year resident.
You're a first-year resident. So
Yes.
tell us how this first year has been.
A roller coaster. It's been a very steep learning curve, I must say. The good thing is that because my husband is already in residency, he's in his final year now, about to graduate. He's in a different program though, but then residency essentially is the same throughout the country. It's an intense time of studying because it's like this is the last official time you get to learn everything you will as a physician.
Yeah.
And then after that, you're on your own. You get to practice on your own. You make decisions on your own. So the learning curve is quite steep. The hours are demanding. It's a lot of hard work. It's a lot of commitment and dedication. But I think mentally I was already prepared for what lay ahead. And he also helped me with the resources. And because I was here, I was more familiar with the entire system, I should say, compared to him. He had a rougher start that I am having. Yeah. So I mean, we always joke around that I'm the privileged one because he had to just sink deep and then he had to just survive, keep his head up. But it's been a very interesting experience. Generally, I really like the patients population in the valley. They are very appreciative. They're very graceful population.
Yeah.
They appreciate every little thing you do. I mean, it's my obligation and it's my job.
Right.
But then they go the extra mile to let you know that you're actually making an impact in their lives. And I think it's very fulfilling. So far, it's been a good experience.
You'll have to tell your husband that he's blazing the trail for you. That's what he's doing. So how many years are you a resident? You said you're a first-year resident. How many years are you a resident?
Okay, so I'm a resident for 3 years.
Okay.
Residency varies per the program you're doing or the specialty, and it's a range of 3 to 7 years. The longer years is for the surgical disciplines like neurosurgery, orthopedic surgery, general surgery, but then on the average it's 3 years for most of the medical programs.
Yes. Oh, I understand. I see. So do you work when you're a resident mostly by yourself, or are you on a team, or how is your work day?
Okay, so it depends on the service you're on. Every service has its unique experience. But basically, I would say, generally speaking, you're given about 80% independence to work. The major decisions you have to take, you have to run them by your supervisor. So especially in the beginning, I've been a resident for close to 8 months.
Yep.
So I am more independent now than I was at the beginning. But we still are obligated to at least send out documentation for the supervising physician to go over and then append his attestation or his signature. Just because currently you're kind of working under the license of the attending physician. So everything, every liability, every responsibility is directly his or hers. But in terms of independence to work, we generally have a lot of independence. And then on the wards or the inpatient service, we tend to work in teams. So we have the day team, we have the night team, we have the weekend team, we have the on-call team, that kind of thing. Yeah.
Okay. So do you stay on a team pretty much the same, or I'm thinking about hours, or does that rotate, that sometimes you're working in the day, sometimes at night, sometimes weekend, or how do they work, like how your time is?
Yeah, so it changes. That you don't just stay on one team all the time.
Right.
For first year, I mostly work daytime. I have worked a few night shifts, and those have mainly been in the emergency department. But most of our nighttime shifts is in the senior year, so second and third year. And yeah, we do have in some services, you work 6 days out of 7. You get 1 day off, and this is on the average 10 to 12 hours a day.
That's tough.
Yes. And in some other services, you get the weekends off. So when you're doing outpatients, you see patients from 8 to 5. That's like a regular job, and you get Saturday, Sunday off. But most of the time, you're working 6 out of 7 days.
So being in family medicine, what type, I know you're serving everything from babies to geriatrics, but what type of cases are you seeing in family medicine?
Okay, so the majority of our time, I would say, is spent in clinic as primary care doctors. So by primary care, I mean a doctor who takes care of your general well-being in terms of preventative health. So you don't need to be sick before you come see me. So maybe once or twice a year, we schedule an annual wellness exam. So most of our patients tend to have chronic illnesses. So like diabetes, hypertension, uncontrolled COPD, asthma, heart failure. So basically conditions which they have to live with. They don't really have a cure, but they can be managed with medications and lifestyle modification.
Yeah.
So most of our patients tend to have chronic illnesses, and then once in a while, we see patients coming with an acute illness like the flu, like a chest infection, a urinary tract infection, and all that kind of thing. So those are the majority of patients we see in the clinic.
And what do you find are the skills that you need to be able to be successful at your job? Because this is what we talk to our students about, is developing their skills. But I think
Right.
a lot of times, I mean, they understand getting knowledge to study math and science. I mean, most students understand that. But when we say skills, students don't quite understand what we mean by skills. So what would you say are some of the skills that you've developed that have helped you be successful?
Okay. That is a very important question. And the first thing I would say is humility and respect. So you would come to realize, or as you grow, especially in this profession, that the best doctor is not the most knowledgeable doctor. The best doctor is actually the most humble and respectful doctor, because like I said, we don't tend to work on our own, we tend to work in a team. And as a doctor or a physician, you can only do much, but then you tend to rely on the assistance of nurses, medical assistants, phlebotomists, lab technicians, so many technicians to help you in the total care of the patient. So you may have a lot of knowledge, but then you do not know it all, and you definitely are not the best person on the team.
Right.
Yes, your role is very important, but then I always say that you have to always have a very humble opinion about yourself. You shouldn't think too highly of yourself, and then that's also related to being very respectful, because it's a profession that deals with human beings, and human beings have different personality traits and different characteristics. So you have to tend to be very patient and understanding of people. And unfortunately, patients come to you in their most vulnerable state. So then it is your job or your obligation to be able to be very patient and be able to listen to them and help them to get out of the acute problem that they are coming with. Another important skill I would say you should have is you should be very confident. And confidence is not equal to arrogance. Okay, like I said, I happen to be in the minority where I'm coming from, and if I were to look down on myself, I don't think I would be here in the first place. So first of all, you need to have confidence in your good education, and you have to have confidence in your ability to be able to relate well with patients and do your job well. That doesn't mean that you cannot make mistakes. Obviously, you're human, you can make mistakes, and in this profession, experience also matters a lot.
Yes.
So you may be a physician, but then you might be working with a nurse who's been working for 20 years, who's been working for 30 years, and you've just been a resident for a month. Obviously, her experience might come in handy. So even though you are confident that you have the right education, you've been given the right tools to be successful, you need to also not be arrogant, and then you need to listen, and then you need to take good advice. I mean, take advice when it's necessary, and then implement it in your profession. And I think with these few things, you should be a very successful physician.
I think that's a really good point, because we're telling students all of this, but to hear it from somebody who's actually in the field, I think makes more sense, because you practice it every day and you know it.
Mm-hmm.
So another thing that I'm questioning is technology. How much does technology play a part in your day-to-day work?
Yeah, technology is it comes in handy. Even just charting the patient's notes, all the patient's information. There's what we call an EMR, electronic medical record, which we use to access patient's information. And everything is basically technology based. It's good to have a very good grasp of technology. However, there also are very strict rules and regulations, which we call HIPAA violations. So HIPAA makes it clear that patient's confidentiality is paramount. So even HIPAA rule states that it is unethical to treat or to take care of someone who you are directly related to, simply because your emotions might get into the way of your clear judgments and all that stuff. Yeah, and an example is, so I work in the same health system as my husband, but then it would be unethical for me to say, okay, so my husband went to get a checkup, let me just check what his lab work or his blood work said. Yes, without the knowledge of his primary care doctor. So technology, I always say technology is not a bad thing. It's the way we use it that might make it bad. But then definitely having a firm grip on technology is an advantage.
Well, I think it goes back to what you said too about being confident and humble, and know what you can and what you cannot do, and being ethical, following, all the rules that come along with being in the medical field. So what do you see as the future of family medicine? So we're talking to students today who are in high school. So and I will give a perfect example. I have a grandson who wants to be a pediatrician, as a matter of fact, and he will probably be practicing, let's say he has 4 years of high school, 8 years, so 12, maybe 12 to 16 years from now. What can you see as the future of medicine, and especially family practice, which I agree with you is a very well-rounded field to be in?
Okay, so I would start by saying the field of family medicine is one of endless opportunities. Yes, it's well-rounded. Yes, it's broad-based, but then there's also avenue to specialize or to go further into so many aspects that even I myself, I had no idea about. I thought I had done a lot of research. I thought I had the knowledge prior to getting here, but then I realized that at the end of the day, for people especially who are uncertain of their path, and I say this to even those who think they may know that this is what they want to do. You actually are not 100% sure until you get into it.
Right.
So you might think that you want to be taking care of children for the rest of your life, and then you get into it and you realize, is this what I really want to do? Yeah, so family medicine to me gives you that foundation. And all the other specialties, more or less, you are able to delve into it. So, I mean, I can choose after my training, I can choose to work as an ER doctor, for example,
Right.
spend hours working in the ER, seeing patients, fast-paced acute cases. When I get tired or if I feel like I'm burnt out, I can just switch to the clinic and then become a PCP, that's a primary care physician, which is a calmer terrain, more predictable and everything. I could also choose to work as a hospitalist. So, hospitalist is someone who works in the hospital ward. So, you're seeing patients acutely and then you discharge them. So, you don't follow up the patients like a primary care physician would do. But the
Right.
patients has already been stabilized by the ER doctors. Now, they've transferred care to you on the ward. Then you could also go into the other branches, like I mentioned. OB is there. You can go into surgery, some form of surgery. We have family physicians just doing surgical procedures, and that's all they do. You could go into sports medicine. I work with one of the doctors. He happens to be the doctor in charge of the Vipers basketball team in the RGB. And we've had privileges. We go and watch their games as physicians, and that's his job. Okay,
Right.
so he's a family medicine doctor, and then he just did an extra year. And the good news is most of the fellowships in family medicine are just a year's duration.
Right.
So you just need to do 1 year, and then you can focus on that if you wanted to. But then you also are not restricted to that area. You can always come back and then work as a family physician. So for me, the possibilities are very endless, and
Yeah.
I think it's a very, very good specialty, especially if you don't know exactly what you want to do here.
Yes, it's very versatile. It really
Yeah.
is a basis for so many other fields. And I agree with you. It is one reason we have the PATHS program is to expose students to medicine beyond doctor and nurse and all the other fields that are available. So thank you for bringing that point up. So the next thing I want to ask is, what's the best part of your job? What's the best part of what you do?
Okay, so yeah, there are lots of good things. To me, the best part of my job is to just seeing the smile on my patient's face and the feedback that I get. And I get a lot of blessings. Like, you'd be surprised, especially from the elderly population. I mean, sometimes you just talk to someone for 5 minutes. You didn't even do any pharmacological intervention. Just by speaking and listening to them, they feel relieved and they're like, "Doctor, my symptoms went away," and they are just blessing you and they are just saying good things about you. And I feel like at the end of the day, it makes all the years in school, all the stress worth it. And the fact that I also get to meet so many different people is also something that I like about the profession. So you meet so many people every day, apart from clinic. Even when I go to the OR in theater, most people are apprehensive about surgery. You get to calm them down. After the procedure, you see them back to their normal selves, especially the athletes. They're able to go back, participate in sports, excel at what they do. And it gives you a very good sense of fulfillment. Yeah, so those are things I love about my job.
That's great. So let's think of the flip side of that. What's the most challenging part of what you do?
Yeah, so I did mention, I spoke about the vulnerability of patients, and I would say especially when patients come in acute phases, they are very ill. And sometimes, human as you are, you might be exhausted yourself, you might be going through things yourself, you might be having a crisis yourself, but you have to be the bigger person because at that point, you're the patient's doctor. You're the one the patient is dependent on. So that becomes a challenge sometimes when you have to put your emotions aside, put whatever you're going through aside, focus on the patient, and try to listen to their concerns and arrive at a solution for it. We also have some patients who might be difficult. It's not all it's not all rosy. I've experienced some physically aggressive patients, Well, fortunately, I haven't really had any racial discrimination, which I'm thankful for, but then it does exist.
Yeah.
And not just racial, but even gender. Some people looking down on you simply because you're female. They think I look young. Am I good enough to be their doctor? I just try and always redirect the conversation and say, look, I am qualified for this job. However, if you're still uncomfortable with me seeing you, I could give you another option or something like that. But you always have to take the professional stance and just eat up your emotions, at least in front of the patient, and then, just get the job done. So those are some of the challenges. Besides the long working hours, sometimes like holidays, Christmas and New Year's, everyone is with their family, you have to be on call, that kind of stuff. But that's the sacrificial aspects of the job. So
yes, I'm sure. My last question for you is, what advice do you have for high school students who are thinking about going into the medical field?
Okay, so I would say thumbs up. That's a great decision. Just thinking about something is one step out of the way. But first of all, I would also say you should also know what you're getting yourself into. Medicine is a lifelong commitment to learning. And we cannot deny that you should be able, or you should be ready to learn for the rest of your life, better yourself, because the guidelines that existed yesterday are not the same that's going to exist next week. There's always research coming up. There's always new guidelines, new recommendations. So you have to keep abreast with the times. So you should be ready to be committed to lifelong learning. You should also know your why. Know why you're getting into this field. Okay, I know most people talk about the remuneration,
right?
Which is honestly, what I always say is that I think there are easier ways to make money.
Yes.
Because if I wanted to make money, I didn't necessarily have to go through maybe sacrifice my 20s, and even some people go into their early 30s and all that stuff, just being a student.
Right.
So if money is the sole reason, then probably you're going in for the wrong reason.
Exactly.
It's a life of sacrifice, constantly putting others before your own needs, and sometimes before your family. But if you know your why, you know your passions, what keep you going, and then also what comes naturally to you, it always makes the journey easier.
Yes.
So there's medicine, but then there's different specialties. So I wouldn't go and be an orthopedic surgeon simply because I hate standing for long hours in the OR.
Right.
And that's like the core of the job. So I wouldn't do something that I honestly do not enjoy liking. So I would rather go into something that is easier or comes more naturally to me. So if you know that, okay, this is really your passion, you should do your research and then know that, okay, definitely I need to focus on these areas like biology, physics, chemistry, biochemistry. Those are the areas I need to excel. And then you also need to do a lot of rotations. Like you need to work with physicians who are already established in their fields, because you need a total application. So it's not just about your grades. It's about what have you done to show that you're really ready for this field. Yes. So have you done voluntary work? Have you worked with an underserved population? Have you given your time freely? All that kind of stuff. So it takes a whole application besides the grades to be able to be successful. So once you know why you're getting into it, and once you've decided that this is the route I'm taking, then you shouldn't let anything make you give up. You should be determined, you should work diligently at it, and definitely you will be successful.
Dr. JB, that's, I think, the best advice we've gotten from a medical person is know your why. Know why you're doing what you're doing. I want to thank you for joining us today. This has been a great conversation, and I appreciate you taking time out of your very busy schedule to be with us. So thank you.
Thank you. Thank you so much, Miss Claudia, for having me here.